Have you ever really stopped to think about what happens to your health info the second you walk out of the doctor's office? It doesn't just sit in a folder anymore. It enters this huge, complex digital world, one that's changing like crazy for both doctors and for us, the patients. So let's dive in and unpack this fascinating and, yeah, sometimes super frustrating world of digital health data. Really, it all boils down to this one simple question. Where does your health story actually live? Is it stuck in some digital file cabinet locked away in a clinic? Or is it something dynamic, something that you carry around with you, right in your pocket? Well, as we're going to see, the answer is kind of becoming a little bit of both. Okay, so to really get what's going on here, you've got to understand that your health data basically lives in two totally separate worlds, like parallel universes. They're connected, sure, but they're operating with completely different goals. So on one side, you've got the clinician's world, right? This is the world of doctors, hospitals, insurance companies. And in their world, data is all about diagnosing you, treating you, and let's be real, billing. It's a system built for providers. Then on the other side, you've got the patient's world. This is our world. It's powered by our smartphones, our smartwatches. It's all about tracking our own wellness, engaging with our health, and really just taking back some control. All right, let's start by breaking down the clinician's side of things. I'm sure you've heard these acronyms tossed around, EMR and EHR. A lot of people use them interchangeably, but they're not the same. They sound alike, but they represent a really crucial difference in how we think about health data. So first up, we have the EMR, the electronic medical record. The easiest way to think about this is like a digital file cabinet. Seriously, it's just the 21st century version of that old paper chart that sits in your one doctor's office. It lives there, and it's not really meant to go anywhere else. But then you've got the EHR, the electronic health record. And this is a way bigger deal. Think of it as your complete health story. See, unlike that EMR that's stuck in one office, the EHR is built to travel with you, from your family doctor to the lab for a blood test, over to a specialist, and even to the hospital. So here's the bottom line, right? An EMR locks your story in one place. It creates what we call a data silo. But an EHR, that's designed to break those silos down so that any provider who needs to treat you gets the full picture. And believe me, that difference is absolutely critical for getting good care. All right, so that's the doctor's world. Now let's flip things around and talk about the patient's world, our world. This is where you finally get to be in the driver's seat with something called a personal health record, or a PHR. So what is a PHR? Well, think of it as your own personal health diary. The key difference here is that unlike the EMR or EHR that your doctors control, the PHR is collected and managed by you. It can have everything in it. Notes from your doctor, lab results, even data from your fitness tracker. It's your personal tool for bridging the gaps between all those different doctor records we were just talking about. And hey, if you've ever used a patient portal online to check your test results, guess what? You've used a PHR. This is where you really start to take back control. Instead of sitting by the phone for days waiting for a call, you can just log in and see your lab results yourself. You can book appointments, shoot your doctor a message, get a prescription refilled, all without ever having to pick up the phone. It's all about putting the power back in your hands. Okay, so now we have these two separate worlds, right? The doctor's world with its EHRs and our world with our PHRs. The big billion-dollar question is, how do we get them to actually talk to each other and do it seamlessly and securely? I mean, this is the central challenge in all of digital health. Think about it. If your main doctor uses one EHR system and you end up in an ER that uses a completely different one, how in the world do they share potentially life-saving information about you in an instant? Well, the answer is you have to build a kind of digital foundation for all of them to stand on. And that foundation has a name. It's called a Health Information Exchange, or HIE. The best way to picture it is as a secure data highway. It's the network that lets all these different hospitals and clinics, even if they're using totally different software, to find and share patient information securely right when they need it. But here's the catch. For that data highway to work, all the different systems on it have to speak the same language. It's a concept called interoperability, and it happens in 3 stages. First, there's the foundational level. Can the systems even connect to each other? A simple plug and play. Then there's structural. Is the data formatted the same way? But the holy grail, the most important level, is semantic. This means both systems understand that when one says systolic blood pressure, the other one knows exactly what that means. They understand the meaning. But as you might have already guessed, or maybe even experienced yourself, this digital foundation is not perfect, not by a long shot. There are some serious cracks in it, and those cracks can have very real consequences. Yeah, the challenges are pretty massive. You've got different systems that don't talk to each other, creating those data silos we mentioned. You've got constant worries about privacy and security. A lot of the software is, frankly, just clunky and designed terribly. And doctors and nurses are just getting buried in notifications, which leads to this really dangerous thing called alert fatigue. Okay, check this out. This next number might seem kind of random, but it points to one of the biggest hidden problems in digital health, 46%. What is that? That's the percentage of clinical notes that are just copied and pasted from an earlier visit. Yeah, it saves time for the doctor for sure, but it creates this massive risk of spreading old or even flat out wrong information all through your medical record. And remember that alert fatigue I mentioned? Here's what that looks like in a nutshell. Imagine you're a doctor and you're getting hundreds of pop-up alerts on your screen all day long. Most of them are totally pointless. What happens? Your brain just starts to tune them out. You start clicking override on everything, including that one critical warning that could have stopped a really serious medication error. And this is why bad design isn't just annoying, it's a real barrier to getting good care. Can you just imagine being a super busy doctor and you have to make 38 separate clicks on a screen just to order one simple blood test? That's not just frustrating for them, it's incredibly inefficient. And every single one of those clicks is another chance to make a mistake. So, with all these challenges, where do we go from here? Well, the ultimate goal is to move past just keeping records and start using the data to build a better, more transparent relationship between you, your doctor, and your own health information. And one of the coolest movements happening right now to make that happen is called Open Notes. The idea is so simple, but it's totally revolutionary. Just give patients full access to the actual notes your doctor writes about them after a visit, and the results are amazing. When you can read the exact same notes your doctor's reading, you feel more in control. You actually remember what you're supposed to do for your treatment plan, and you end up building a much stronger, more trusting relationship with them. And that really brings us to the big idea here at the end. What if we stopped thinking about our health data as just some static, historical file? What if, instead, we started seeing it as the beginning of a conversation, a real dialogue between you and your healthcare team, with technology helping it along, all focused on one simple thing: keeping you healthy.